Discussing topics trending in the medical world, and as always, we are joined by Dr. Syed Hussain, Trinity Health of New England. Doctor, thank you as always for being here. June, as folks may know, is Men's Health Awareness Month, and this morning we were hoping to have a conversation with you about a type of cancer we hear a lot about, breast cancer, but in men, which I think we don't talk about a lot at all. Talk about that picture. Men can get breast cancer. What do we know?
Yeah, so in the U.S., Keith, 1 out of every 100 breast cancers that are diagnosed will be in men. So it's fairly rare, but it's something that folks need to be aware of as to what the symptoms are, what risk factors go into this. So symptoms include redness, swelling lump in the breast, nipple discharge, for instance. The risk factors include older age, so usually above the age of 50. Folks that have had a family history of breast cancer need to be aware. In first-degree relatives, if you have a rare genetic mutation called BRCA1 or BRCA2, if you know anyone in your family who has that, then that's another risk factor. Hormone replacement therapy, previous radiation therapy to the chest, these are all risk factors. Now, having a risk factor does not necessarily mean you're going to get breast cancer, but it's something to keep in mind when you visit your primary care doctor. So the doctor may recommend some genetic counseling, some genetic testing to understand the risk and what needs to happen as next steps. So one basic take-home message here for men is make sure you have a primary care doctor and you get your annual screening.
Which is not as easy to find right now as some might think, so get working on that. Another topic I want to talk about, Eric and I are both in purple today, is summer solstice, longest day of the year, but also shining light on Alzheimer's and dementia. It is an ongoing conversation as people are living longer these days. Warning signs and symptoms there, what should we know? Yeah,
this is a sad disease. Unfortunately, it increases with age. The risk of getting Alzheimer's increases with age. It can lead to memory loss, along with loss of ability to do activities of daily living. So that's balancing your checkbook, having a normal conversation with your neighbor, for instance. Folks tend to lose some of that. Those are early signs. There are various stages. There is no cure for Alzheimer's, although there may be medications that temporarily relieve some of these symptoms. There is a promising trial currently underway, but there is no cure.
And younger loved ones, we can play a role in all of this, looking for potential warning signs too. Don't necessarily depend on folks to pick them up themselves.
Absolutely, 100%.
It is good information as always. We appreciate your taking sometimes complicated medical stuff and making it easy to understand. We appreciate that. Dr. Syed Hussain, Trinity Health in New England. We will see you back right here next Wednesday. Absolutely. If we can get Tim off the golf course, he'll be talking to you. All right, good stuff. Thank you, doctor.